This question is asking us, which of the following best describes the role of a medical assistant in a healthcare setting? So let's look at the options. Option A says a medical assistant primarily performs independent diagnostic testing procedures. The key word here is independent because typically certain diagnostic testing, a medical assistant would not be performing independently. If this is the type of test that's used to officially diagnose a patient, usually you would have someone who's very skilled in that specific role who would be helping, and you wouldn't be independent in that role. So we can eliminate choice A. Choice B says a medical assistant supervises nurses and other healthcare professionals. So if we take a look at this word supervises, this is typically referring to a manager position or someone who oversees the clinical practice. So this usually would not be the medical assistant's job to supervise the entire practice. That would usually be a supervisor or a manager. So we could eliminate choice B. Choice C says a medical assistant independently develops and implements patient treatment plans. So developing and implementing a patient treatment plan usually involves coming up with some sort of diagnosis, deciding how to best move forward from here, maybe decide any lifestyle changes, any medications that need to be adjusted. And this sounds more like the role of a provider and not so much the medical assistant whose responsibility that is to develop and implement a treatment plan. So we can eliminate choice C. And then choice D says, a medical assistant functions as a multi-skilled member of the healthcare team, providing both clinical and administrative support. And yes, this is correct, because if you think of the role as the medical assistant, maybe you're collecting blood work, which would be a clinical skill. Maybe you're taking some vital signs for your patients. That's also a clinical skill. But you also would be supervising in an administrative role in some capacities. Maybe you're helping to schedule appointments. Maybe you're helping the logistics of where patients should go next. Maybe you're helping with insurance information, which is more administrative. So you're definitely in a multi-skilled member of the team, doing many different things, and you are a very vital part of the healthcare team, being a medical assistant in the setting you're working in. So the correct choice should be answer D.